ALZUMAB, a first-in-class novel biologic for the management of psoriasis. ALZUMAB is an infusion therapy indicated for the treatment of patients with active, moderate to severe chronic plaque psoriasis who are candidates for systemic therapy. Each 5 ml vial of ALZUMAB contains 25 mg of itolizumab, a humanized recombinant anti-CD6 monoclonal antibody. The recommended dose of ALZUMAB to be administered for the treatment of plaque psoriasis is 1.6 mg per kg, to be given once every 2 weeks for the first 3 months and then every 4 weeks for the next 3 months. Calculate dose and number of ALZUMAB vials required based on body weight of the patient at 1.6 mg per kg and round off to the nearest whole vial size. For example, a 60 kg patient requires 60 times 1.6 mg, which equals to 96 mg, or 4 vials of ALZUMAB. Before initiating the infusion process, clinical assessment of the patient needs to be made. Vital signs like temperature, BP, and pulse need to be monitored. Body weight needs to be checked. Patients should be evaluated for active tuberculosis and tested for latent infections. A complete patient medical history needs to be taken. Patient's eligibility for biologic therapy based on the analysis of the above assessments needs to be checked. Initiate the infusion with the consent of the treating physician. To begin the infusion, keep the supplies ready, like gloves, IV set, saline, and the pre-infusion medication as directed by the physician. Remove the seal from the pack. With the carton box facing upward, pull the ribbon to access the vial. Do not shake the vial before opening, as shaking may disrupt the protein structure of ALZUMAB. Remove the plastic cap from vials of ALZUMAB. Aseptically withdraw the required volume of ALZUMAB from the calculated number of vials. Vials of ALZUMAB are for single use only and do not contain any preservatives. Therefore, any unused portion of the solution should be disposed and not be stored for reuse. ALZUMAB should be administered via an IV infusion in 250 ml of 0.9% sodium chloride solution. Slowly inject the total volume of solution of ALZUMAB into it. Gently mix the solution, allowing it to reach room temperature. Connect the infusion set that includes an inline, sterile, non-pyrogenic, low-protein binding filter to the IV bag containing ALZUMAB. Infusion should begin within 4 hours of preparation. Prime the line, ensuring removal of air from the set. Attach the set with ALZUMAB into the port closest to the patient in the primary infusion line. ALZUMAB should not be infused concomitantly with other medications in the same line. Start the infusion on a slow drip. The infusion solution must be administered over a period of at least 2 hours with monitoring. In the first hour of infusion, monitor the vitals of the patient every 15 minutes. Only 50 ml of ALZUMAB needs to be infused in the first hour with another 200 ml in the second hour. Flush the IV line with saline to ensure ALZUMAB is completely infused. Monitor the patient for 1 to 2 hours post-infusion. In case of chills or rigors, stop the infusion and inform the treating physician. For further information and clarification, kindly go through the package insert enclosed with the ALZUMAB vial. Visit us at www.biocon.com.